Good evening, everybody. At the outset, may I please request anyone who's not speaking to mute their videos so that we have better bandwidth across, if possible. And welcome to today's session entitled Stem Cell Therapy for Autism and Intellectual and Developmental Disabilities, Research, Not Cure. At the outset, I just want to introduce both myself as well as the organization that is sponsoring this event today. So my name is Sushama Nagarkar. I am the managing trustee of Yash Charitable Trust, and under the aegis of Yash Charitable Trust, which works with adults with intellectual and developmental disabilities, I should say works with and for adults with intellectual and developmental disabilities. We have a program called Adult Support Kendra. And the Adult Support Kendra was set up a couple of years ago by a bunch of us professionals in the field. And we provide we have various activities under the ASK, as the acronym is, that support adults in all facets of their lives as they grow up from children to be adults with intellectual or developmental disabilities. So we provide counseling services, we do workshops, we do seminars like this one. There's a lot of our work currently is around advocacy and the whole issue with stem cell therapy being one of those projects that we have taken on. We also have employment support services where we register participants, adults, and try and place them in jobs. As you well know, this is challenging. But we've got a wonderful group of professionals, counselors, as well as just people who care about this, our diverse populations, as well as wonderful two paid counselors who provide both online and offline counseling services, both individual and group, to the adult population. So if you need any more information about what we do, we are on Facebook, and you can always get in touch with us via the website or any other way. But again, thank you and welcome to this seminar for today, which is a very important one for us. So the plan of the session is like this. We are going to start off with the three speakers, and I have to thank them from the bottom of all our hearts for sparing their valuable time for this. So they're going to speak for about 15 minutes, perhaps each of them. Following this, we have made arrangements to have various interpreters with us today. Again, a big thank you and shout out to all of them because they're going to provide interpretation for Marathi, Telugu, Malayalam, Hindi, and Bengali. So we'll have the three speakers speak for about 15 minutes each, following which we'll have a 10-minute breakout session, 10 to 15 minute, maybe we'll see how it goes. And after the breakout sessions, and the whole purpose of the breakout session will be to sort of just summarize what the speakers may have spoken about, which may be easier for many people to have summarized in their native language of choice. And after that, we'll resume with the question answer session with the whole group again. So this is kind of the format of this evening, and please post your questions in the chat box. The questions and the answers that our eminent panel will give are really, really important for us because this is a huge issue in our world currently. I'm going to introduce the speakers to you in the order of which they are going to present to us. And so here goes with the first one. Ladiwala, Dr. Ladiwala, and I have to read this, so excuse me for looking elsewhere, did her MD in pathology from Grant Medical College, Mumbai. She later switched to basic research in neuroimmunology and worked both in Mumbai and as well as abroad at the, I can't say this, but I'm going to try, Karolinska Institute in Sweden and the Montreal Neurological Institute in Canada. On her return to India in 2001, she worked at the Tata Institute of Fundamental Research, TIFR, in Mumbai, researching neural stem cells. She continued this when she set up her own lab as faculty at the new DAE, Center of Excellence in Basic Sciences, Mumbai. She's recently joined the Adult Support Kendra of Yash Charitable Trust as a consultant for this project. Next, we have with us Dr. Anaita Udwadia-Hegde, who's a consultant in pediatric neurology with the SRCC Narayan Children's Hospital, BJ Wadia Hospital, and Jaslok Hospital. She is also the president of the Association of Child Neurology, India, and the medical director of the Jai Vakil School for Children in Need of Special Care. My apologies, actually Dr. Hegde was to present last, so, but I'm just, in my list, she's second, but she will present last. Second, after Dr. Ladiwala, we have Dr. Vrajesh Udani, who's a consultant in pediatric neurology with the PD Hinduja Hospital, BJ Wadia Children's Hospital, and the Saifi Hospital. He possesses more than 34 years of clinical experience. He serves a large referred population of children with intractable epilepsy, neurometabolic disorders, autism, and other neurologic problems. He is also a retired assistant professor of pediatrics and neurology from the Grant Medical College, Mumbai. I welcome all three of our very, very experienced panelists, and we all look forward to an interesting and participative session. Thank you. I'll hand it over to Uma right now.
Hello and welcome everyone. Am I audible? Great to see such a good turnout. Even though I'm going to speak about stem cells and autism, this also applies to some of the other conditions like cerebral palsy. So let's begin by understanding what are stem cells. Sorry. Oh God. So the basic unit of all living organisms is the cell, which many of you might know. And the human body is made up of literally trillions of cells. There are more than 200 types of specialized cells that perform different functions.
Sorry, Uma, your slide is not moving.
Sorry?
Put it on full screen.
And your slide is not moving.
It's not moving, meaning is it the second, is the first slide?
It's just the
first slide, but it's introduction, but there is no full screen. Put it on full screen.
Oh, okay, 1 minute. Okay, where is it? It's
on the bottom, on the bottom.
Next to the red line, on the bottom red line,
sorry.
the fourth icon. Yeah. No, it's still not.
Still not full screen?
No, that bottom fourth icon.
So this goes back to this. It is okay. Puneet, you want to help me?
Sure. In the view, there's an option called slideshow above.
1 minute.
Animation slideshow review.
No, maybe you can do the slides for me then.
Okay, sure.
Shall I get out of screen sharing then?
Yeah, do that.
Okay, I think that's better. Shall I try again?
Yeah, because I somehow can't do that. Can you try again?
Is it working now?
Yes.
Yes.
It's fine?
Yes, yes.
Okay, great. Okay, so so going back to the cells, as I said, the basic unit of all living organisms is the cell. And the human body is made of trillions of cells. Of these, there are more than 200 types of specialized cells that perform different functions. You know, like for example, heart cells, skin cells, kidney cells, etc. And all these specialized cells come from stem cells. So here is a image of a plant with its stem, which holds all the leaves, fruits, flowers, and buds, which is where the name comes from. Oh God, okay. Okay, so by definition, a stem cell is an unspecialized cell that is capable of dividing indefinitely and gives rise to these specialized cells. So the diagram illustrates how this can happen. This is the primary stem cell, and this divides, giving rise to one stem cell and one slightly specialized cell. Then both cells divide further, and each one becomes, this specialized cells becomes a little more specialized. In this manner, after many more divisions, the fully specialized cell is formed, seen below here. And meanwhile, at the time of division, the stem cell that makes a copy of itself also continues as a stem cell. Thus, you get this remaining pool of stem cells that can still form specialized cells if required in case of damage or loss of cells. So there are different types of stem cells depending on what stage you take them from. Very early after fertilization, you see the formation of an embryo happen. And if you take cells from this clump here called the inner cell mass, it's named, this is the stem cells you get are called embryonic stem cells.
Has she gone off or have I gone off?
He's gone off.
You get adult stem cells which are present in most organs. So making specialized cells, oh yeah, sorry, I think my connection is a little weak. So the embryonic stem cells can make many different types of specialized cells, almost all cells of the body actually. Whereas adult stem cells make far fewer specialized cells. And usually these are cells of the organ where the adult stem cell is located. For example, brain stem cells make brain cells. And in the bone marrow, there are some different types of stem cells. So one type makes blood and immune cells, and the second type makes bone, cartilage, and fat. But adult stem cells can also be made to make specialized cells of other organs. For example, bone marrow stem cells can be made into brain cells. Now, this is seen in animals, and if you take stem cells out, grow them in a dish, add some special chemicals, okay? But what per se, is this also always happening in humans? And this is a question mark. It's perhaps, some people do report that this is seen, some people say no, so this is a little controversial yet. Stem cells have some useful properties and functions. The first one, of course, primarily being to replace dead or damaged cells in organs. They also secrete growth factors. These are chemicals that are very helpful to cells around, somewhat like vitamins. And some stem cells can even suppress the harmful immune responses. So which stem cells are used in, have been used in studies for autism and other IDDs? So one is from the individual's bone marrow, which is located in some bones of the human body. And so these are called bone marrow MSCs and bone marrow MNCs. We'll see later what these stand for. Then there are the umbilical cord blood stem cells also that have been tried. Even embryonic stem cells, and in some studies, fetal stem cells. So the route of administration has been variable. It's sometimes in the spinal region, sometimes intravenously, and sometimes intramuscularly. So I'll describe briefly from some of the studies that have been published in India, what is the procedure that they commonly use. And very often, most studies that have used bone marrow mononuclear cells for this transplant procedure. So what is done is that they aspirate with a syringe the bone marrow, which is deep in the hip bone. And then the aspirate is seen to contain a mixture of cell types. So there are, of course, the red blood cells and all these other cells, which include stem cells as well. This aspirated bone marrow is then placed on another reagent and spun in a centrifuge. And this is to separate out some of the cells, especially the red blood cells, which you can see then that they settle at the bottom. And there is this layer above, which contains this mixture of cells, including the stem cells. Some people then may put it in a plastic flask, and that's when the stem cells will stick to the flask and the floating cells are thrown away. But other studies more commonly have just used all this mixture of cells, including the stem cells, and injected it back. So where the injection is done, now this is a diagram of the brain in the head and the long elongated spinal cord from which a lot of nerves innervate the body. The spinal cord has 3 coverings, and between 2 of the coverings is the fluid called the cerebrospinal fluid that goes from the spinal cord around the brain, and it circulates like this. And it is in this space between the 2 layers that the cells are injected into the spinal cord. You can see here that, of course, this is very close to the spinal cord then. And of course, there is always the danger that there could be damage to the spinal cord. So this is a risky procedure. It's not really very minor. And we'll see later what other side effects that can come about. So in the study, what they did, that once the individual has recovered from this surgery, the doctors then have given extensive occupational therapy, behavioral modification therapy, and speech therapies, etc. So it's usually not been just stem cells alone. It's been a combination of all these things. So is the procedure safe? Firstly, there have been mostly short-term follow-ups varying between 6 and 26 months. And some studies have reported side effects. So even though you may hear the doctors saying, oh, it's very minor side effects, it's absolutely safe, but side effects have been known, and these are nausea, vomiting, headache, and epilepsy as well. As I said earlier, the procedure has its risks, and in this one study, 9% of the patients had epilepsy. There is no data of long-term follow-up. So can there be long-term side effects? Well, yes. In fact, there is a case study where a tumor occurred after stem cell therapy. In fact, a benign, which is a non-cancerous tumor, 12 years after stem cells from the nose were injected into the spinal cord region, because they took a biopsy from this lesion and they found that the cells were the same as the stem cells that had been injected earlier. And embryonic stem cells are known to lead to tumor formation quite often. So is this stem cell therapy, into inverted commas, effective? Firstly, this cannot be called therapy as yet, because it's still being researched, and at best, it can be known as a clinical trial. Most of these studies have, however, not been well designed. And so even if studies report that there is a 90% effectiveness with improvement in behavioral symptoms, one cannot really come to firm conclusions. Also, you have to remember, as I said earlier, the stem cells were given in conjunction with this intensive rehabilitation therapies. So is it the stem cells or is it just the therapies? Because these were not controlled studies. And here I think Dr. Udani will go a little deeper into explaining about this. And only one well-designed international study showed that there was no significant effectiveness of stem cells for autism. So fortunately, there are guidelines seeing a lot of this stem cell work happening and therapies being done. The Indian Council for Medical Research, ICMR for short, laid down national guidelines for stem cell research in India. And this is a Delhi-based central government body. Initially, the guidelines were set in 2007 and most recently updated in 2021. So in inverted commas, I have taken quotes, these are quotations from the guideline document, which clearly says that stem cell therapy should not be offered as standard or routine therapy to patients with autism. Further, they say, unfortunately, most of these studies have one or more flaws, which prevent us from drawing an unbiased and valid conclusion to support the use of stem cell therapy over and above the behavioral and support therapies. As these studies have used behavioral therapy along with the stem cell therapy, it is not clear if the observed benefit is from intensive supportive therapy during the initial period and at long-term follow-up. Further, they have regulations for clinical trials. One is that participants should have read and signed the informed consent form, which explains to them alternative therapies, possible benefits, as well as harm due to experimental treatments like stem cell therapy. Participants in a clinical trial should not be made to pay for any expenses incurred. And this is important because we have come to hear of people who have gone in for this treatment and have had to pay exorbitant rates. Further, compensation is to be provided in case of harm or permanent injury or death due to the use of experimental stem cell therapy. So in conclusion, the current use of stem cells as therapy is as yet unverified and not recommended. Further research is required to determine its safety and efficacy. And this is from the ICMR guidelines 2021. So you could ask me, are stem cells allowed for any condition at all? Yes, so bone marrow transplants of stem cells is recommended for some blood and immune disorders, like some leukemias, some lymphomas, these are cancers of the blood. And ICMR has also allowed one stem cell product called Stempucel. These are from bone marrow stem cells for a type of blood vessel disorder. Other than these, the use of stem cells in all other diseases is investigational and must be done within the purview of a clinical trial. Thank you.
Thank you, Uma, for that technical but interesting presentation. One of the things I forgot, ladies and gentlemen, to mention at the outset is, why is ASK even addressing this? We consist of a group of professionals, as I said, but also parents. I'm also a parent of a young lady with autism, as are Parul and Anand. And, across our networks, our individual networks and our work in this field, we've come across thousands is an exaggeration, but many, many horror stories of families having to, taking these decisions of doing stem cell therapy at the risk of mortgaging their house, selling their jewelry, and just not thinking long-term, searching for a cure. We've all been there and done that. We're all looking for that magic pill that's going to, create so-called normal person out of our child or adult with autism. So we thought it's really important because there's so much marketing out there that kind of convinces us, yes, this is the way to go. It's going to provide everything and an improved quality of life for us, for our, not only our children, but our entire family. Because as most of you will know, autism is not restricted to a person, but it's the family constellation also has to be very, very supportive, and a lot of differences occur in families when we have a person with autism in our household. So this is why ASK decided to take on this very important topic, and we're doing it at multiple levels. You can get in touch with us to find out what else we're doing. We're also doing a qualitative research project. So if you know of anyone who's actually undergone this treatment, we would love to be able to talk to them to find out what is it that makes families even attempt to do this. Our endeavor at the end of this seminar is to just provide information to families and professionals so that evidence, well, I shouldn't say the magic word, but families make informed decisions about, what therapy or what treatment or what intervention they choose to invest in. And that's the whole basis. Just inform yourselves of what's out there, what works, and which is why I invite now Dr. Vrajesh Udani to make his presentation, which is going to go along these lines. Thank you.
Thank you, Mrs. Nagarkar.
Sushma.
Sorry, Sushma. Thank you, Uma, for setting the stage. I think I'm going to be speaking a short talk on how pediatric neurologists see it from our point of view and also the patient's point of view. And of course, what we need to understand about how therapies are investigated and what exactly, why is it that some therapies which appear to be very useful at the outset may turn out to be something else completely. So I'm going to share my screen. So I'll just talk on, I won't be going very technical because a little bit of technical, yes, but most of it will be, what we expect when we look for a therapy. Oh, so what are the factors which are implicated in the what causes autism? So what exactly, why does this condition occur? First of all, you must understand it is not a disease. It's a broad range of heterogeneous condition where you have lots of causes. Actually, you may be having pure genetic causes, you may have genetic and environment and all sorts of things. But the most common one, which most of us see, is so-called the one where we don't know exactly what causes it. So in that particular type of autism, this garden variety, which we see all the time, and which probably explains about 90% of what is going around, these are the factors which in 2021 are the things which are important. The first, of course, are genes. And genetics of autism has really exploded with the genetic testing explosion, which has come about in the last decade or so. And at present time in 2022, we have maybe 2,000 genes which are somehow linked to the autistic disorders. Obviously, all of them don't cause the autism. Many of us have those genes, but about 11 of them, at least the last time I read, appear to be very high risk for autism. And these, of course, they're either inherited or they may occur de novo, so in the sense the parents don't have the genes, but they may occur by themselves after fertilization. The second and the most important thing, which is now becoming very obvious over the last 30 years, in fact, are environmental factors. And then what happens in the critical period of development, which is 1 to 3 years. And as you can see, this young infant is playing on the mobile, and this seems to have been now fairly accepted, that using the mobile and screens and stimulating the right hemisphere with the visual input does not really help the left hemisphere, which needs language input and interaction with parents, etc. And this is something which I had mentioned about 25 years ago in the Times of India article, where we had postulated that this was such a common history which we got, that it could be one of the important things which actually add to the burden of this condition. And there are many others as yet unproven triggers. Some of them have been disproven, like vaccines. So now we know that vaccines don't cause or don't trigger autism, but there are many others which I will not go into. Current theory of what happens in the autistic brain is illustrated in this slide. I'm sure all of you know that brain cells are connected to each other, either short distance or long distance, and they're also connected to the spinal cord cells as well. And the figure on the right, which is this one, shows normal organized connectivity of an infant or a young brain. However, the brain in autism is hyperconnected, and this is because of technology and when we MRIs, etc., and specialized MRIs of the brain and PET scans, etc., we find there are a lot of connections, a lot of unnecessary connections, and which makes the child's head even slightly larger. And then later on, many of these connections, the ones which need to be strengthened, are not strengthened, especially if the environment doesn't foster that, or they may actually become less so over time, and you might become hypoconnected. And these things finally lead to the state of slightly decreased cognitive and other skills, which even high functioning autisms may have. The new theory, and this I mentioned a question mark, is immune dysfunction or inflammation or immune alterations. And these are some of the cells which are involved, the T cells and the B cells. You won't go into that. But this is not, something which is fully accepted, but probably there may be a role. There is some evidence that it has, but many people have not found this to be really consistently. And we, in fact, used in my past immune altering drugs, unfortunately, without any benefit. And the most important thing is when you see pathology of brains which are autistic children and adults, you do not find any structural brain injury. You do find changes in size, but there is no structural brain damage as such. So where are stem cells postulated to act in this autism spectrum disorder? Obviously, genes cannot be changed, especially if you're giving the stem cells, the bone marrow stem cells from the same individual back to him. And we all assume that those cells will also be having the appropriate or the mutations or changes in the gene which have caused the autism in the first place. Environmental factors obviously will not be changed. So over here, environmental factors are what we deal with in behavior therapies and occupational therapies and telling them how to completely restrict screens, etc., etc., etc. But this has nothing to do with stem cells. Brain connectivity also, it's very difficult to understand how brain's connectivity would change with stem cells. But there are people have postulated a link, but there's no proof at all that it happens. So they don't seem to act in this way. Structural brain injury, where stem cells are very ordinarily used. It is in trials like stroke, like cerebral palsy, etc. But there is no structural brain injury. So there is no restorative function which the stem cells would be useful. And so what we come to is this immune alterations. Do the stem cells somehow reduce the immune alterations? And this is a big question mark at the present time. So switching a little gears and coming to what we expect from any therapy, whether it's a drug, whether it's behavioral therapy, whatever it is, we expect it to be efficacious and we expect it to be safe. And these are easily said, but very easy to confirm, very difficult to confirm in actual practice. So, when you give a treatment, most patients feel they give me something, makes me feel better, so it works. You give me something, it doesn't make me feel better, so it doesn't work. And of course, it's not as simple as that, lot more complicated. So let's look at the factors which actually influence the results of treatment. So look at the natural history of disease. Suppose you don't give any treatment at all. I mean, this is one of the things which parents tell me, that आपने कुछ दवाई नहीं दिया, इसलिए अच्छा नहीं हुआ, इसलिए अच्छा हुआ, और अच्छा नहीं हुआ. So if you give them medicines, they're happy because it gets cured, even though you may have given them vitamins. So the natural history of the disease or condition, can it improve? Can it get cured by itself? Bias. So whenever you give something to somebody, everybody wants it to become better. The patients, the parents, the doctors, and therefore there is a bias if you just ask them questions. And most of the trials in many of these kind of disorders are parent questionnaires. Did it help your child? And you're hoping for a yes, therefore you say yes. And then I'll explain about the placebo effect. So natural history of diseases. This is, of course, all medical diseases. 70% of human illness gets better on its own. And this includes all types of human illness, right from infections to, whatever disorders you have, things get better. The body itself fights, and positive attitudes also in the patients seem to help in this, and things get better. So just because something gets better, it doesn't mean that the treatment you've given to that person has really had any effect. Bias, like I said, everybody wants patients to get better. So subjective assessments are really very difficult to, quantify. And you want an objective assessment. You want a biomarker, say a blood test, which increases or decreases, or you do an EEG or something increases it, whatever, some sort of change which you can actually quantify to see if there's something which has helped. The problem is in autism, no real consistent biomarker has been found. Biomarker means it tells us about the state of the disease at that particular time. And finally, like Uma already highlighted, if you have multiple therapies on, and the guys who do stem cells, they're extremely smart. They insist that you do the stem cells, and along with that, you do 3 to 6 months of intensive therapy. Now that therapy is also going on and is absolutely forced for 6 months, and that may help, and then everything is, of course, the good guy over here is the stem cell. So maybe you will give it again, because if you don't give it again, you might again get bad. Now, what about the placebo effect? This is an example of a doc giving a drug and a placebo, and this is what the clinical trial and control trials are basically based upon. But there was this, just to give you an idea, this was a trial on asthma. So I'll just put this away. This was a trial in asthma where they gave albuterol, which is a drug in question. They also gave a placebo, which means you give something else, maybe saline puffs or whatever. Then they did sham acupuncture. So acupuncture, but without any needles. And of course, there was a small group where no intervention was done. And as you can see, the drug used for asthma, the placebo, and the sham acupuncture, all subjectively, the patients felt better. But if you now, same patients, you try to find out the objective change in lung function tests. So, when you give a drug, you expect a change in the biomarker. And the biomarker over here is the lung function test. You make the guy breathe into a machine and you find out how hard he's breathing and stuff like that. So you can see the only thing which really made any difference was the drug. And the rest did not make any difference. The placebo, the sham acupuncture, and the control. So essentially, this is what we want in our studies, but it's easier said than done. And then the doctor makes a big difference. This is a guy who is giving you, a caring provider, is giving you a lot of time in the clinic, will make a lot more difference than this guy who's a little apathetic. Sorry. Yeah. So now you do the clinical trial. And so I just tell you what are just the basic principles. I'm sure many of you are science people and even the people who do research all the time. So I'm sure all this is old hat for you. But for those who may not know this, when you do this, there has to be a rationale. You must have a reason why you suspect that this particular drug or particular therapy will work. There must be safety testing, and that has to be done in animals and humans. But animals, you have to have a model of the human disease, which is, very difficult to make in autism. And then you have to have pilot trials in humans, so the safety testing in humans is done usually on volunteers, like, the vaccine, which was on volunteers in the COVID pandemic. So you should ideally do a double-blinded, just repeat that, double-blinded, randomized control trial. This is the best trial to make sure the two treatments are different. So the drug is different from the placebo. So you take the patients, subjects who get the treatment, the control subjects who are similar patients. So they have to be matched, the same age, the same gender, all those kind of things, and you match them. And then they receive placebo. And then you randomize it. You don't choose, okay, you get the drug, you get the placebo. You actually do it by computer numbers, or you do alternate patients or something, or you make them draw out a slip of paper. So it's a random choosing of the subject. So there's no bias of the physician involved, that this fellow might do a little better. And remember, bias is very often unconscious. It's not something which is consciously thought of. Then you get blinded. That means nobody knows, of course. This, this, the doctor doesn't know, the patient doesn't know, the parent doesn't know. So the subjects are getting treatment or placebo. And sometimes in drugs, you may have to actually disguise them in different bottles. And you might, suppose the drug is very strong, a smell or something, you may have to use the placebo also has to have the similar kind of smell. That kind of blinding is important. And you must have a large number of subjects, because the larger the number, obvious differences, even small differences will become obvious. In small numbers, which is the usual case in all these kind of trials, it's just not enough. You might not get any significance, even if there is. And finally, effective treatments do not often undergo RCTs. For example, GFCF diet. So many people use the gluten-free, casein-free diet. There are many parent reports and many, even physicians prescribe it. But it's okay. I mean, it's 3-month, 4-month trial with something which is not going to harm you in major ways. So you can do a trial in the patient if you want. And there are many trials which are using drugs. For example, many years ago, there was a drug called Secretin. And now there was a lot of interest in oxytocin, because there was a small trial from Australia that when you gave this nasally, children with autism improved. But when it was subjected to a large number of patients, I think about 750, there was no difference at all. So all these are been disproven by RCTs. Now, what about stem cells and autism? So I looked it up in the PubMed. This is the National Institute of Health in the US, which looks at all the articles, and you can see that between 2002 and 2022, the last 2 decades, the number of articles on autism and stem cells, huge, 758 articles, 758. And this, of course, examines not only the use of stem cells, but the effects and this and that. So there's a huge amount of research going on. And then you look at the clinical trial. So I just put a filter, clinical trial. And from 758, only 9 results. From the 9 results, one was not a real trial, it was a review. So I can remove that. And one was retracted because the results were not sure whether it was false or whether they were made up or whatever. So the real thing is only about 7 trials. And then from these, only 1 RCT, I think Uma has already mentioned it, but I'll just tell you what it did. So really very little information. This was a safety and observation study from a placebo-controlled crossover study. I tell you what a crossover study is. To assess the use of autologous, means the patient's umbilical cord blood stem cells. So cord blood stem cells. So where did you get these cells? Because these parents had banked these cells when the baby was born, and then now they're using it on them to improve symptoms in children with autism. And the very small numbers, but they thought these were enough. They had 15 patients and 15 controls, and they followed this for about 6 months or so. And there was a crossover design. So what is the crossover design? First, they were evaluated, all of them, in the baseline. Some tests were done for language, for social behavior, etc. And then some were blinded in a blinded fashion. Some were given, 15 subjects were given placebo, and 15 subjects were given the stem cell infusion. After which they waited, they did an assessment over here, and then they crossed over. So those who got the infusion were now given nothing, placebo, and ones who were given placebo were now given the infusion. And then, so this was like a patient acting as his own control. And finally, at 49 weeks or something, at the end, they had finished everybody's evaluations at the end. And what did they find? So they tested specific validated scales of language. Expressive means speaking language, and receptive means understanding language. So there are scales for both. And socialization. These are the 3 core symptoms of autism. So of course, there are many other symptoms which were not really tested. And they found that more or less, it's all the same. The red and blue lines are not really different, significant statistically. What they found was one thing for sure. There was no obvious safety concerns in this small group. Larger group, we may find something more, something like tumors, etc. But the small group, they didn't find anything. No significant difference in any outcome measure. And look at the recommendation. They are not saying that it does not work. It says further studies are needed. In that sense, in science, only if you can give an unequivocal result using very large numbers and multiple studies saying the same thing, you don't accept something as truth. And now look at what's happening in India, China, the third world countries. It's funny that the third world countries have these unregulated stem cells clinics, while the regulated like US, UK, etc., you can actually go to jail if you use stem cells without a purview of a clinical trial. And just look at this, there are 19 websites, and look at the treatment. Stem cells for brain, heart, allergies, for Alzheimer's, stroke, MS, autism, everything possible. If you have tomorrow a pain in your back also, they'll probably give you a stem cell. And there is low-grade evidence. There's not a single study except the ones which were mentioned by Uma, where they've been approved, one particular condition after years of research. So in conclusion, patients should be wary of the claims made by stem cell clinics on the internet, the direct-to-consumer portrayal of stem cell medicine. And this is happening all over the world. In the US, I went for and I found that on TV, they actually directly, even approved medicines are being directly marketed towards actual consumers. So this is commercialization to its maximum. And this is the reason why, even a good thing, it might be stem cells might work. God knows whether they will or not, but you definitely need more research, and you should never, ever test them or use them outside the purview of a clinical trial, and especially charging for this money. Thank you very much for your attention.
Thank you very much, Dr. Udani. That was, I think, Uma's technical presentation and yours combined. I think we all understand very much better what where the field is at the moment. I now would like to invite Dr. Udwadia-Hegde to sort of tell us what works. I mean, what's current and what is relevant for us to know. So again, as parents and professionals, we make informed decisions.
Thank you. Thank you,
Sushma.
Sushma. I think you'll have already covered a large chunk of it, so you've done most of the work for me. Sorry, why is it not moving? Can you see the presentation? Hello, can you hear me? Hello?
Yes, yes. We
Yes,
can
yes.
hear and see.
Okay, so great. So basically what I'm going to cover is, I think what Sushma very nicely highlighted, that a whole load of parents in the hope of finding a solution for their child, not only try stem cell, but try a whole load of other untested therapies as well. And believe a lot of things which are told to them by people without adequate scientific research behind it. So the first thing that strikes you, and as a parent, I think you should ask yourself is, what causes autism? To know how to treat a condition, and that's how we physicians and doctors learn, is we have to know what causes it and what is it that we are trying to fix. I think something's gone wrong and it's, hello? Sorry, it keeps freezing. So, if you look at what causes autism and you see it over the years, you will see that the numerous theories have been postulated. So let's start with immune. I think Vrajesh described as well immune dysregulation. So whether immune modulators such as steroids or immune suppressive drugs can actually help them. Hormonal imbalances, whether the role of secretin, melatonin, oxytocin.
Sorry to intervene. We cannot see your screen.
Oh, sorry. Something has gone wrong. Can you see it now? Can you see it now?
No.
No, no,
Now? No?
no, no.
Is it all gone or is it still stuck on the previous slide?
All gone. The
Oh.
screen is not being shared.
Okay, 2 seconds. Better? Better?
Yeah, yeah.
Okay, so sorry. So these, when you're looking at the cause of autism, these are the different theories which have been postulated. And because these different theories have come out, you will have parents who have invariably tried at least 2 to 4 of these different therapies for their children over a period of time. So I have parents who are giving their children chelating agents for months on end. And we know that chelating agents are associated with significant side effects. There is mitochondrial dysfunction as a pathology. Yes, omega-3 fatty acids and minerals do not have major side effects, but this theory has been postulated but not proved. Chronic inflammation or neuroinflammation, so they're taking anti-inflammatory agents. Oxidative stress has been tried. Dysregulation of monoaminogen or neurotransmitter disorders. This to some extent has some documentation, and that's why the drugs are tried on them. Some people have in the previous tried that all children who have EEG abnormalities, even if they've never had a seizure, were put on medications because they thought the autism and the epilepsy go hand in hand with them. Hormonal imbalance, Vrajesh nicely highlighted the role of secretin, oxytocin, which was postulated but not proved to be beneficial. Immune modulation, and like this, there are numerous theories which have come out. There's one theory which has stuck in most people's mind for many, many years, and that was the MMR vaccine. And I actually had a patient today with me who fought with me and convinced me that the MMR vaccine caused all the problem, and there are so many people who complain about it. So while it did come out many years ago, I would like to highlight and point out to everybody that the journal which published it many years ago actually retracted the article. Not only did it retract the article, this is a little story of how it happened. It was Dr. Wakefield with 12, they did a study of only 12 children. That is not considered a study, that is not considered research, of which he said 8 parents complained they felt it was related to that. Possible environmental trigger was postulated. Then for publicity's sake, he goes around the place telling everybody you should not take it or you should take only 1 dose or change it. The authors then reviewed the study in the Lancet and it was and found that it was manipulated for the purpose of publicity and for the purpose of getting awareness. And eventually they withdrew the article in 2010. Not only did they withdrew, they took away the license of the people who did this study, and they were not allowed to practice subsequently. Likewise, there are lots of theories, B6, magnesium, and autism. So I know when I started my practice, every child was on B6 and magnesium in high doses. And I'm not saying no, because I'm sure we also did try it at ourselves, because at that time we didn't know much about it. But even a vitamin like B6, if it's given limitlessly for many years, can have associated side effects. So irritability, hypersensitivity, urinary incontinence, neuropathy, and photosensitivity can come if you take high doses of B6 for prolonged periods of time. So very often a parent will say, but doc, it's only a vitamin. What difference does it make? My thought is that if something is not needed and not proved to be beneficial, do not just put it into your child because you are hoping that it will give you some benefit. The immune system, the gut, as Vrajesh nicely pointed out, the GFCF diet, when a study was done on it, it was not found to be beneficial. Yes, that 1 or 2 children who have diarrhea and vomiting and irritability every time any wheat goes into their tummy and they run to the loo every few minutes, they may have a gluten allergy, but that's not related to the autism. Okay, that may be just because he does have a gluten allergy, which is there. To put all these children onto a GFCF diet when there is no proof to it, I think we need to take it a little carefully. So as a parent of a child with autism, you want to see your child have the best life to its full potential. So when a clinic offers an alternative therapy such as stem cells for autism, which sounds like a miracle cure, you may want to immediately pursue it. You want to try anything that can help your child get better in this world. So we totally understand where you are coming from and why you try these things. But I truly believe that before you try something on your child, you should, 1, question what it does. 2, is it beneficial? And most important, am I sure that there will be no harm that it can do? So stem cells, as Uma has very nicely highlighted to you, is a wonder cell. There is no denying that stem cell has tremendous potential for the future, has tremendous potential for science. And these are the different ways you can use it. You can use it for regeneration, where you want to repair a system which is dysfunctional. You can do transplant medicine. We are creating stem cells in the labs, and you are making organs out of these stem cells, which tomorrow can be used for transplants. You can study a disease process with the stem cell, and then you can put different drugs on it and see how it benefits. So what is ongoing research in stem cell? These are all the different conditions where research is happening for people with the use of stem cells. So there is tons of research happening on stem cells and huge stem cell labs coming up everywhere. But I think the important word is, what is research and what is treatment? Okay, when you say it is research, you sign up for a research project. The goal is to learn about your child's condition. You must use, as Vrajesh nicely pointed out, standardized procedures. You can be assigned to a placebo group, means you may not get a treatment and you may get a treatment. The safety and efficacy of that cell or that treatment, whatever it is being done, is not known when you go into this research project. When you go into research, it is free of cost. The cost is fully covered because you do not know the outcomes. You are willing to try it on your patient at the cost of it being free. And the aim of research is to advance science. When a physician comes and tells you this is a treatment, he is telling you that this condition will get treated or cured with the treatment. He is telling you that this treatment can be customized to your parent. We don't give the same drug and the same dose to all children with epilepsy. We give different drugs, we give different doses, we study their weight, we do all that, and then we adjust it according to the patient. So that is treatment. We try and tweak it so that we get the best outcome and the best care for that patient. It's not one size fits all. Not only one size fits all children with autism, one size fits all people with all neurological disorders. Whatever condition you walk into that lab, You will be treated with the same stem cells in the same manner, in the same everything. Now you tell me, with whatever limited knowledge, how can one treatment work on every single condition and every single variation of that condition? Safety and efficacy is supposed to be known. You are responsible for the costs and you pay for it, and it focuses on what you need and not on research. So do remember, there's a big difference between research and a big difference between treatment. So as Uma nicely pointed out, stem cell is not there. Bone marrow transplant has come, and it's come for a lot of blood cancers over the years. We are now doing it in a large number of, or few number of neurodevelopmental disorders. This is the latest one which came out 2 months ago, where they take the child's stem cell, they do gene therapy on the stem cell after they studied it, they put it back into the child, and they'll be able to make the enzyme that the child couldn't make it. And it is going to be revolutionary for children who have metachromatic leukodystrophy. So work is happening, research is progressing, and we are hopefully going to get more solutions as we go down the line. But there's no clear cause. Here I have a gene, I have an enzyme which is deficient, I have a symptom package which tells me what the gene is doing and what the enzyme is doing, and I'm trying to correct it. I'm going to study the enzyme, I'm going to study the MRI, I'm going to study after the treatment to see what's happening. What do we study? As Vrajesh said, there is no parameter, there is no biomarker, there's nothing I can study to say, because I really don't know yet what causes it. And another very important take home before I end is that brain growth is maximum in the first 2 to 6 years of life. Look at the charts, whether it's numbers, social development, symbols, language, vision, habit forming, hearing, emotional control. Large chunk of it is happening between 0 to 3 years of age. So this is a very important, what you call the critical period of a child's development. And unfortunately, what I see is many parents, when you tell them the diagnosis, they start running to all the different treatment options available under the sun. And in the bargain, what happens is they miss the things that actually might help their child. So while you have numerous therapies for autism, from behavior to social skills to speech, aqua, animal, ABA, or etc., there are many therapies available. And while we wait for more understanding of the cause and effect of the disorder, we recommend that you maximize the critical period of brain development. You stick to conventional proof therapies till something comes from all the research that's happening. I do realize, I do want to tell you that yes, stem cells is the future, but it is only in research till today, and it should not be used on a commercial grounds with no protocols, no ethical approval, no scientific proof. And let's hope, be patient, and let's hope, I think science will find an etiology or a cause for the autism, and likewise, then we will be able to help you find a cure. Thank you. Thank you.